Good evening, Miss Smith. My name is Angelica Swaste, and I am going to be talking to you about STDs. STDs are sexually transmitted diseases, also known as venereal diseases. Some examples of STDs are HIV, which stands for human papilloma virus infection, genital herpes, gonorrhea, syphilis, and some forms of hepatitis. According to Planned Parenthood, STDs are carried in semen, vaginal fluids, and blood. Others can be passed from genital skin-to-skin contact. STDs are common and usually do not have any symptoms, so sometimes people don't know that they have STDs. The only way to never get an STD is to never have sex. But the best and safest way for you to have sex is to use condoms. There are many different types of condoms. There are male condoms, female condoms, and other forms of contraceptives that you could use so you do not get STDs. These contraceptives, if you will, can be purchased at your local pharmacies. You could get them at CVS, Walgreens, and even grocery stores carry them. Also, you could be tested for STDs at your local Planned Parenthood, and or you could go to community hospitals. Actually have a lot of information as well. STDs can be tested. It's a very fast, easy, inexpensive procedure. Testing can be done through blood. They can also swab different areas of your body, genital areas. Also, you could get tested for women, pap smears, and through men, they can actually do the swabbing test through the penile area, and those tests are sent off to the laboratories and sometimes take up to 7 to 10 days for the results to come back. Testing, again, can be done at Planned Parenthood or at the hospitals. It's very inexpensive, sometimes even free. There are different places that offer free testing, so you should look into it. Community hospitals and Planned Parenthood will have lots of information for you to call or find clinics that have free testing. So you may want to check that out. Now, another question some people may have is how often should they get tested? If you are having sex with one partner and, it's regular sex with the same partner, you may want to get tested once a year is the normal. Now, if you have more than one partner, you may want to get tested, 2 to 3 times a year, just depending on how many partners you do have. So you may want to check into that. You could, again, get the information at the Planned Parenthood, and, it doesn't matter the age. Some people, start off very young having sex. Teenagers, of course, need parental guidance or somebody, parent or a relative who could take them to these types of clinics, and who could sign off on paperwork. Of course, somebody who has an ID or a relative could take a child, all the way up to 60, 70-year-old people that are still having sex could still be tested. It's normal. It's very common for people to have STDs. Some of them don't have symptoms, so you never know. If you are having sex, please get tested. It will help many people in the long run. HIV, it's just a personal story. I have a relative who was diagnosed with HIV and unfortunately was told he had HIV well into him having HIV, and he passed away recently. So please, I cannot emphasize enough for people to get tested, and that is just a personal experience. I feel terrible. He was not aware of where he could get tested and just was not knowledgeable at all about the subject, and was very embarrassed. And some people get embarrassed and they should actually talk to people and try to get some help. It's nothing to be embarrassed about. We are all human beings, and just asking each other, not criticizing other people. Many people have this, but do not ask any questions because they're so embarrassed. So please check out your local Planned Parenthood or community hospital. They will have information. Thank you.